One pattern I've noticed over the years in a small cohort of patients is those that regularly teach and or practice yoga and those, to a smaller extent, who participate in Pilates. The pattern I've noticed is that those patients tend to have an extraordinary amount of lumbar flexion, meaning when I ask them to touch their toes, they're getting palms on the floor or even their head to their knees, and they're missing quite a bit of extension in comparison. So when they go into backward bending, they're missing a significant amount, especially in comparison to the way above normal they have in terms of lumbar flexion. Many times when I ask these patients what's been going on with their back, they will say that in yoga, or to a smaller extent Pilates, if they go into lumbar extension, it hurts, and so they've avoided it, or they don't push into that pain. And yes, that makes sense. We don't want to necessarily push into pain. It could be a warning sign not to do it. In many cases for mechanical problems, I do have people push briefly into pain under the rules of safety that I use in terms of addressing pain and understanding what pain is. But for many of these people, moving into extension and restoring their normal extension is what they need. Sometimes it's a lateral movement, but oftentimes the complaints in the low back, in the buttock, or in the lower extremities are mechanical in nature, and therefore restoring normal mechanics via restoring lumbar extension for these patients is what they need. Now, for someone who has a ton of flexion, they probably naturally have a ton of extension, or not necessarily naturally, but through training have the ability to have a lot of lumbar extension. For people who do have a lot of lumbar extension or who start to gain a lot of lumbar extension, I may have to modify any extension exercise that I prescribe. For example, extension in standing, putting hands on books, or doing sustained extension at a very high height to get the maximal amount of lumbar extension. But the other thing to think about in terms of yoga, for many of my patients, they like to do yoga on a semi-regular or infrequent basis. I tell them they can be discerning about the type of yoga that they want and that's best for their backs. Now that hopefully I've taught them about mechanics of the spine or hips or knees, they can think about their classes that they attend, yoga or otherwise, and if they're a ton of forward bending, if the yoga class is predominantly flexion and doesn't involve a lot of rotation or extension, for example, that may not be the best class for them. They may want a class that's more balanced. It can go the opposite way, although I don't think of a ton of yoga classes being biased toward extension. I love to keep my mobility, and I do little mobility things throughout the day or when I'm at the gym. Nothing intense by any means, but for me, I've been to a couple yoga classes and they focused a lot on forward bending. Now, it could have been just that day, but I don't need to go into quite a bit of forward bending in my free time if I spend a lot of time kind of sitting in lumbar flexion. So for me, that's just personal preference. And what I tell my patients is it's personal preference, but you can kind of think about the mechanics of the class and if it meets your needs.